Yeah, hello everyone. I'm GIJUNG Im from Korea University, and welcome to South Korea. And enjoy the WCA 2026 Seoul. This program is a PHPHI, and then my topic is hearing loss in South Korea and the global perspective. Uh, and I pay my respect to the late Professor Oh Seung-ha and Professor Andrew, who established the PHPHI Korea program 2024, 2025, and now is 2026. A brief introduction to the degree of hearing loss, WHO standard and criteria. So disabling hearing loss referred to hearing loss greater than 40 dB, 35 dB in the better hearing ears in adults, and then in children the 30 dB. And age-related hearing loss it ranks fourth in global incidence of disability. And then the disabled, the adjustment life years, the DALY score is about 20 in 2001, 2010, 2012, 2021. The WHO usually uses such a situation analysis tool to assess the ear and hearing care situation in each country. It consists of the Section 1 and Section 2, general country information and assessment of health system capacity. So like this. And then this is Korea's answer. So important point is in South Korea, disabling hearing loss is about 10%, and the 60s disabled hearing loss is 52%. And then primary step is 0.05, and tertiary is 0.007. It's a little bit less than advanced country, I think. Republic of Korea is a total population is more than 50 million, and the 31 degree in the world, and GDP is about 2 trillion. It's the 50th in the world. The problem is the total fertility rate is 0.72, so it ranks almost the last place in the world. Yeah, so you can see the total fertility rate is abruptly drop in South Korea. Korea is disappearing, driven by the world's lowest birth rate. We are progressing toward a super-aged society. You can see the changing pattern of population pyramid in South Korea: 60, 22, 72. So the hearing loss prevalence is 5 million people, so the 10% of total population, like this. And 6 years older is 52%. And then congenital hearing loss is 6 people per 10 births. The main cause is aging and noise, genetic, and ear disease. So let me show you my studies. Nationwide study of hearing loss. This is about disabled registered hearing loss and national registration data. So in South Korea, use the sixth grade. The hearing loss divided the standard of 90 dB, 80 dB, 70 dB, 60 dB, and then the unilateral hearing loss. Yeah, 0.5124 kilohertz average. So the Korea's hearing impairment classification system is very systematic, and support for hearing aid also expanded. And now is a one hearing aid after 5 years. This is the status of hearing loss from 2006 to 2015. A stable population and good environment for big data research. So the Korea's population increases very steadily. And then population of severe found hearing loss is peaked in 2011 and then decrease. The gender rate is annually very similar, 50 to 50. However, the men have a higher rate of hearing loss than female. The highest peak is 2011 in both sex, and then gradually decreased to 2015. So total hearing percentage of 2010 was 0.5% and decreased 0.46%. And hearing loss was always higher in male population. And then certified hearing loss in Korea is 0.5%. And then overall population is 0.25 millions and peaked in 2011. This is absolute number of hearing impaired people's estimated by age. Under the 40, always decreased. And then the seniors, there's some highest peak and then decreased. However, this more than 80 is abruptly increased, right? So fortunately, hearing impairment in South Korea is decreasing across all age groups, but it is increasing explosive among those aged 80 and old. So this is a definite evidence of aging population in South Korea. But this graph is a prevalence of hearing loss. So does a prevalence of hearing loss decreased gradually in all age groups annually in South Korea, even in more than 80 dBs. So you can see some peak point, right? So declining across all age group based on a certain point in time. So the small summary, this study demonstrated the total prevalence was 0.46 in South Korea, showing turning point peak of hearing loss 0.5%, almost 0.25 millions in 2011. The hearing loss higher in male, 1.2 times than female, and higher in rural area. And this prevalence of hearing loss decreased gradually in all age group annually, although the absolute number of hearing loss cases increased rapidly among those aged of 80s because aging population of South Korea. It's some kind of mirror of a advanced country. Yeah. We follow the hearing loss patterns of advanced country, but the reverse tone, we can see the reverse tone. So 2016, the Korean government suggests one free hearing aid provided every 5 years. So the registered hearing impaired number up to 4.4 times increased. So some confusing data nowadays in the big data study, but maybe it will be stable as time goes on. So these kind of important hearing related big data should be updated annually and managed by a credible organization. So these data will serve the national policy decision, WHO statistics and planning, and systemic life cycle hearing management in South Korea. So the main focus of a future plan of South Korea is integrated hearing management throughout life cycle, consists of 6 stages: newborn baby, infant, school age, occupation, retirement, and old ages. So I will show the suggestion of the CI financial and health insurance coverage. All CI surgeries in South Korea increased from about 500 to 1200 cases. So percentage of device returning rate is 0.4 to 1.31%. This is related to CI device surgery failure. It peaked with the launch of a new product in 2022 and then declined after. Maybe the reason is as surgeons become more accustomed to the new CI implant, so T-fold over and the CI failure are becoming less frequent. However, above statistics excluded the cases where the surgeon reload and reinsert the CI electrode to the cochlea again, so maybe electrode kinking that can be underestimated in reality. Yeah, so the priority for CI support must be set, right? The health insurance budget is limited. So our first proposal is external speech processor. Second is a pediatric patient with asymmetric hearing loss. And the third is bilateral CI coverage. And then 4.5 is mapping and speech therapy support. And then hearing aid, like this. The future plan of South Korea for hearing aid. So expansion of criteria for certified and registered hearing impaired standard. So from 60 dB to 55 and even more next to 50 dB hearing loss. So annually, and then automatically support and government a free hearing aid every 5 years to these registered hearing impaired persons. And then support for bilateral hearing loss in pediatric patient, and then the expanding support to adults. And then the export support hearing aid with bilateral hearing loss of 40 dBs with 50% of co-payments, and the bilateral hearing loss under age 65, co-payment of 70%. Bilateral hearing loss is 40 dB. However, it costs so many financial support, estimated about 82 billion Korean won. It's huge money. So Korea's future hearing plan is integrated hearing management throughout life cycle. The CI insurance coverage expansion is focused on the CI speech processor, and then hearing aid is focused on expanded criteria for hearing impaired individual, for example, from 60 dB to 55 dB, and then support for bilateral hearing aid. Thank you so much. Yeah, welcome to Korea, and please enjoy the 2026 WCA. Thank you.